The radical, fundamental principles of freedom, rational self-interest, and individual rights. This is the Yaron Brook Show.
All right, welcome everybody to the Yaron Brook Show on this Thursday afternoon. And, timing's a little unusual for the show, but I wanted to accommodate the unbelievably busy, hectic schedule of Dr. Adalja. Amesh is with us today again. So thank you, Amesh, for taking some time off to do the Yaron Brook Show, and welcome.
Well, thanks for having me back.
Sure, of course. So we're gonna be talking for about 40 minutes while we have Amesh on about coronavirus and the situation and what's going on in the world right now. And then I'll do the super chat questions after. Although if you have kind of an urgent question you want to ask Amesh, then feel free to use the super chat for that. You can access the super chat on YouTube. So a lot has changed since we last talked. I think we were a little bit more optimistic last time about this maybe being seasonal. Doesn't look like it, and maybe getting this under control. What's your assessment as of today of what's going on, at least in the United States?
Well, what we're seeing is the fact that stay-at-home orders lifted and people started to socially interact, and this virus is spreading efficiently from person to person. I think it's important to remember when we talk about seasonality that we extrapolated that from other coronaviruses. And what seasonality has to do with is more with surface transmission. When it is hotter, when it is more sunny, when it is more humid, you see less common touch surfaces causing spread. It doesn't interfere between a person giving it to another person. There's no way for the weather or the environment to stop that. And the fact is, we have so many people that are susceptible to it that you're not going to see that type of seasonality as pronounced as you would, for example, with the coronavirus, where there is some population level immunity. And that's what the phenomenon is. We never thought it would fully suppress. We thought we might see some, but what's happened is some states have seen surges of cases with percent positivity rising in hospitals, again, feeling the pressure. And in general, the bottom line is that, again, we've made the same mistakes over and over and over again. They were happening at the federal level in January, February, and March, and now they're happening at the state levels. And this is actually inexcusable more at the state level, because those states that got hit, that are getting hit now, Florida, Texas, and Arizona, had a long time to figure this out and do it properly, to get contact tracers, to know what was going to happen, but yet they failed again. So this is really the same mistake over and over again by our political leaderships.
Yeah, I mean, that is to me what is so shocking. I have to say I was fairly optimistic, and on the business side, I even told my partners in the hedge fund, no, I mean, a second wave might happen, but the states are going to get their act together because they've just seen what happens. And it truly is shocking what we've talked about, you've talked about, not me, you've talked about the fact that it's about testing, tracing, isolating. What is it about this that is so difficult that our political leadership is failing over and over again so dramatically?
I think that there's an unwillingness of state and local governments to actually spend the money to hire the contact tracers and to get rid of the friction to hire them. So remember, getting hired by a city or a county or a state government is not an easy process. It's not like getting hired by any other company. There's so much paperwork and background checks. There's so much friction. I know some of my friends in the health department telling me they have great candidates to hire, but it's just the bureaucracy is so slow. And then they don't really want to spend the money on it. They think, can we get away with maybe a little bit less contact tracing? But then when you have a huge number of cases, you've overwhelmed your contact tracers, and then you say, we're not even going to call. Like I heard, for example, Los Angeles County is just they're only prioritizing certain contact tracers, not doing them all. And not surprisingly, you get percent positivity rising and these undetected chains of transmission that spill into the hospital. So it seems to me that our political leadership has decided that that's how they don't want to do contact tracing. And they don't want to prioritize it. And we're going to continue to see that. And in states that have had contact tracing put in place, maybe we'll do a lot better than the ones that don't.
Are there good examples of states that have done it? Are there any examples of that in the US?
There are states so I would say New York has done a good job, but New York hasn't fully opened. So we don't know what it's going to be like when they hit the full brunt. And they did pause indoor dining in New York City. But other parts of New York do have indoor dining. We're not hearing about problems there. So I know that New York, as they reopened, they made a metric for how many contact tracers each region would have. And I think that might be the best way to do it, because otherwise you see governments trying to skimp on it and trying to get by. And I think that's what's happened, is it wasn't prioritized, and people thought we didn't get hit hard bad, so maybe we don't need to have these contact tracers. Not realizing the biology of the virus is the biology of the virus, that that you can't evade it. It's going to come back and it's going to hit you because it's in the population and it's not going anywhere until we have a vaccine.
Yeah, I mean, you've said for months now, really from February, you've said the virus will not go away. I mean, you've repeated that over and over again. And what did I think Trump said yesterday? Oh, it's just going to magically disappear in an interview. It was pretty stunning. This assumption that it'll just go away by itself. What happens if somebody tests positive right now? Is isolation being pursued? I mean, are people actually expected to isolate? And is there any way to actually confirm that that's happening?
People are expected to isolate for a period of about 10 days or so. They don't necessarily confirm it unless there's a problem. So most times health departments give people the benefit of the doubt that they're going to stay home unless they hear a report of this guy's positive and I saw him at the grocery store. They're not going to really intervene. They haven't enforced or put people in jail. We don't have quite Typhoid Mary type approaches yet. And I don't think we hopefully need to go that way. I don't think it's the people that are actually diagnosed that are spreading it. It's the ones that aren't getting tested or the ones with mild symptoms that they might attribute to maybe they're hungover, or maybe they were working out hard at the gym and they've got muscle aches and pains, or maybe their sore throat is because they did so many interviews the day before, like I do, and then and that sore throat is from the coronavirus. That's what's happening. Is these people with mild symptoms that they don't attribute to the coronavirus are likely contributing to that spread.
And so Jennifer asks, how common do you think asymptomatic spread is? I mean, we've seen conflicting kind of reports even out of the WHO about asymptomatic spread.
So this is a complicated question. I'm going to try and unpack it. So you got to draw these two distinctions between asymptomatic spread and pre-symptomatic spread. So a pre-symptomatic person is someone who's bound to get symptoms but hasn't gotten them yet. And it clearly looks like those individuals are able to transmit at some period of time before they develop symptoms. We don't know when that is. People who are truly asymptomatic, who never get any symptoms, that's what the WHO said. Those people don't contribute to the outbreak spread. But it got all mixed up because the press kind of took that out of control, out of context, and then put the WHO as opposed to other people. But it was really an accurate scientific statement, but just couldn't be parsed well by the lay press. So we do think that asymptomatic or pre-symptomatic spread can occur in certain circumstances. Very unlikely with someone who never becomes asymptomatic. And then the pre-symptomatic ones, maybe it's because they don't know exactly when they become symptomatic because they get a mild symptom and then they become contagious. Or it's close contacts in a household where they have a lot more intimate contact than in general general life. And this is, some of the nuances on masks comes from this. And if you want to ask me about masks and how that fits into it, that's where it's this asymptomatic, pre-symptomatic mess that's where the mask recommendation comes from.
Yeah, let's talk about masks. So obviously, again, there being conflicting recommendations. And I also want to talk to you about the politicization of the whole mask issue. But let's do the science first. You've said masks are useful, but of limited use and under certain circumstances. Is that still your view? Has the science progressed? Do we know more now?
It basically still is. So if there's someone that's symptomatic, that is sick, and they're out, they need to be wearing a mask if they're out, even if they have mild symptoms or symptoms that they think might not be from the coronavirus. I've always said that as source control for people that are sick. The question was, does someone who has no symptoms at all, who is free from the coronavirus, do they benefit from wearing a mask because maybe they're an asymptomatic spreader? That I don't think we're not going to ever get to the bottom of the answer because it's very hard to tell. And I do still think that when people wear these bandanas on their faces, they're not getting much benefit. If they're wearing a hospital-grade mask, meaning like a surgical mask, not an N95, or something that's more covering, maybe they are able to decrease the transmission if they're one of those people. It's still the case that masks don't protect you, the wearer. There's no evidence that that's the case. And even the WHO guidance says there's no direct evidence for homemade masks being effective. What I think is probably better is probably face shields. And I think you're seeing more evidence come out that a face shield not only protects you from spreading it, but because it covers your eyes, that also gives you some more benefit. And face shields are easy. They're not as stifling. People don't touch their face a million times and adjust them the way they do with a face mask. And they also are reusable. They don't get strewn all over the city sidewalks like we see everywhere. So I think that face shields might be the better way to go about this. So I use the term face covering. And I think also a lot of us who were trying to nitpick on the science on masks, a lot of us have thrown in the towel because we realize that this is probably a battle that we can't fight because this is the only way we're going to keep things open is if people start wearing the mask. So some of us saying, we can wear the mask if we're going to be able to go do things.
Yeah, I'm seeing a lot of the face shields here in Puerto Rico in restaurants. So the restaurant employees are wearing masks, and on top of the mask, a face shield. I mean, not all of them. Some other restaurants are just doing like cloth masks, variety. They're trying to make it nice because they're trying to keep the restaurant nice. But at least our restaurants are all open, and it doesn't look like they're going to close anytime soon. They've got it under control here. At least it seems that way. What about this? The politicization of this. I mean, it's really pretty pathetic.
Yeah, this whole pandemic has been politicized from the very beginning. This is like the worst I've ever seen it. The way that this has become a litmus test on if you're a Democrat or if you're a Republican, and anything you say, even as an infectious disease doctor or public health authority, it all gets filtered through that context. Is this supportive of Trump or is it supportive of the Democrats? And nothing can ever be truth. It's all kind of relative. And where you are on the spectrum, you can just look on a social media feed. Your friends that are Republicans believe one thing, and your friends that believe the Democrats believe something completely different. And there's nothing in between. It is either a hoax or it is Armageddon. There's no one that actually is pursuing the truth. And it's not just me frustrated. It's public health authorities at the CDC, for example, at the NIH. There's just no way to even navigate this because they have this cult of personality around the president on the one hand, and then people trying to attack the president on the other hand. And the whole thing has just become a big political mess, just like everything else that happens in society now. Everybody's in tribes, and that's how they've approached this whole entire thing.
So I was going to ask you about experts, right? So one of the victims of this tribalization is a view of expertise of scientists and what they know. And it seems like, that's become tribal. So there's a tribe, those who support the president generally, who now disregard expertise, throw it out all. We can't believe any scientists. It's all, in a sense, a hoax. And then you've got the other side who are ready to anoint the experts as, grand poobahs and run our lives. Do you see how do we come back from this? Do you have any thoughts on how we resurrect the appropriate role of science? Really, because it's science. It's not even the scientist. It's science.
I think it almost falls on us as experts to actually say, I'm telling you what the science is. You're the policymaker, so you have to take that and decide how to implement that based on what you know about the virus, what we know about the virus, and what you know about the policies you have and the laws that are on the books that you can enact. What the best policy might be, and I think we have to try. I've tried to keep myself, at least when I'm talking to the general public on mainstream media, away from some of the policy prescriptions in terms of just giving people the facts and then deciding what's safe and what's not safe to do is going to be up to the individual. But this is what I would recommend as a doctor, not necessarily what I recommend as a law or what should be illegal or not illegal. And I try not to allow people to take my words and then use them for a certain policy. That's one way to do it. But I think it's going to be very hard to see this recover because it's become thoroughly politicized from the beginning. And I think, the way that people have attacked experts like Dr. Fauci, it's just it's disgusting because it's really not even, you can attack what his conclusion might be, but they're all ad hominem attacks trying to dig up things from his past, making up stories about him. It's really, really bad. The same thing for Bill Gates as well, who's been pilloried through this entire thing.
And Fauci's tried to say, look, I'm just here to give you facts, and you guys at Congress are responsible for the actual measures you take, and it doesn't seem to help. It doesn't seem to matter. They still go after him.
Yes, because they don't want to. They want to evade, it seems, and then he's a big obstacle to their evasion, so they have to attack him because they don't want to make these decisions. The Congress has abdicated, and the federal government has abdicated its role in this pandemic from the very start.
So there's nothing today really being done at the federal level, it seems to me. Is that right? I mean, it seems like the Trump administration has basically given up. There's some CDC recommendations that go out, but other than that, there's just nothing going on.
Yeah, the CDC and the FDA, you can hear from them. They're doing stuff, putting guidance out and working through some of these issues, but you don't see the task force very often. It's been marginalized. This has all sort of been left to the states, and the states kind of have variable ways of dealing with it. And that's why you have this hodgepodge mess. And you have now quarantines of people going from Florida to New York. There used to be ones the other way around because it's all not coordinated. We have had no federal leadership. The CDC has basically been silenced and unable to talk to the public. The Surgeon General has been embarrassed trying to defend the administration. And people who defy the administration, like Rick Bright at BARDA, were fired because they didn't agree on hydroxychloroquine. So this is just the absolute wrong way to run an infectious disease emergency or anything. And it's really scary because this is how the government this is what we paid them for, to be able to handle us in a crisis, and this is where they have failed miserably.
Yeah, this is the one thing governors supposed to do right, and they failed. I mean, I think we should have. Yeah, I mean, they did so badly after 9/11. We should have not assumed that they could do anything right, really. So before we get to, so where do you see this going now? So the states have obviously failed. They don't seem to be learning. They've almost thrown in the towel in some places like LA. Where does this go from here?
We're going to be kind of stuck with a new normal where we have these periodic flare-ups in different states that can be really rough for the hospitals and healthcare workers and health departments there. And certain places are going to have people are going to say, you can't go there and come back to this place because it's too high of a prevalence. I think that's what's going to happen. I don't think anybody's going to go to any kind of economic shutdown again or stay-at-home orders. What you'll see is surgical types of things, like we're closing bars, or we're going to not have indoor dining, or we're going to pause reopening. I think that's better and an improvement because it's much more based on the science of what's actually causing the spread. But I think that this is going to be still disruptive, even without stay-at-home orders, and that people are not going to feel safe to do certain things, and certain businesses are just not going to open because they don't want to deal with an employee being infected and then they have to shut back down. I think that this is you're getting kind of the worst of all worlds right now, because it's now completely uncertain where this is going to pop up, and that there's just going to be, you can just assume that there's going to be incompetence at the state level and no help from the federal government. So I think we're kind of stuck in a way that none of us ever thought would be managed this badly.
And do you think this continues until there's a vaccine?
Yeah, I do think it continues till there's a vaccine, but then we have to worry about the anti-vaccine movement getting people not to vaccinate. So I think this is going to continue for a while, and I think it's going to hurt the United States because the EU is going to have a travel ban against us, and that's going to be really crippling to the economy and to people's lives. They won't be able to go anywhere. It's really an embarrassment that the country that was the most prepared for pandemics, the one who's basically wrote all the guidelines, set that everybody relies on, is the one now that is the worst at managing it. It's crazy.
So what has the EU done right? Because they had it in a sense a little earlier than us. They had it really bad, but they seem now to have come out of it, and they don't seem to have these flare-ups that we do.
So what they did is a different type of shutdown. They actually did pretty strong lockdowns in order to get the virus as close to zero as they could. And our shutdowns, and I don't think that I endorse that. I don't endorse that, the European style lockdown, but our shutdowns were meant to preserve hospital capacity, get our testing up to scale, and get the testing, tracking, and isolating apparatus up in all the 50 states. Mm-hmm. And we just didn't do it. I mean, it just didn't happen. And what Europe did, even though they had those shutdowns, they put all that stuff into place, and they were able to do it and to be able to move through freely. So if you think about, like, in the United States, we have about 10,000 cases of tuberculosis every year, but we don't worry about tuberculosis when we go outside. It's because we test, track, and isolate cases of tuberculosis, so they don't pose a risk to us. But when it comes to this, there's just a complete failure to even put anything into place, and there's no excuse for it. I mean, it's just gross incompetence and an unwillingness to actually address the problem at its root cause.
Do you think Europe is going to see problems now that it's opening up within Europe? Because not all the countries did the same thing, right? Because Netherlands had a little bit more open. Sweden obviously was much more open. Eastern Europe didn't do really lockdowns. Do you think there's a chance that we'll see flare-ups coming back as they open up?
I definitely think we're going to see flare-ups. I think they'll just be much better at managing them and being able to handle them. We can't handle the flare-ups in many places, is what's happening. Because they haven't done any of the work to actually be able to handle.
Do you think part of why the governors are being so pathetic in their response is because of how politicized this is?
I definitely think so. I think if you're a Republican governor, you're expected to be in line. And if you can think, for example, Maryland's governor is a Republican, and he was much more aggressive early on, and he was getting criticized by the president. He's the one who tried to buy test kits from South Korea himself. So if you are of a certain political party, you're expected to act a certain way. And clearly the Republican governors are disadvantaged because they are Republicans and beholden to the president. And I think that's what we've seen throughout this.
So somebody's asking, the death rate doesn't seem yet to be spiking in spite of the cases spiking. Is that because just of a lag, or is there another reason?
Two things. One is, it is a lag that deaths are going to take maybe about 2 weeks before the spikes occur. But the other thing is that the demographics of infection have shifted. Now younger people are getting infected. The average age for example, where I am in Pittsburgh is now, I think, in the early 30s to late 20s. So that's going to take they're not going to be the ones who die from it. They have to then go infect a vulnerable person. That vulnerable person has to get sick enough to be in the hospital and then be in the hospital long enough to die. So there is going to be a longer time period before we see deaths rise because of this now chain of transmission has to go a little bit longer. The other thing is hopefully we've gotten much better at dealing with these patients. We recognize it faster. We know the complications. We can intervene with the complications. We're better at using mechanical ventilators. We have some new medication tools that we can use. So hopefully we'll keep the mortality rate lower than what it was before. But I do think we will see deaths continue. I think that people have to be very straight with the American public that this is going to continue. We're going to see more cases. We're going to see more deaths. This is now a matter of fact. It's just with us now, and we're kind of stuck in the bed that we made for ourselves.
So there was a story out of Italy. One of the doctors there who was there during the really bad period was arguing that the virus is mutated, that the cases are much less severe now than what he saw, let's say, in March. Is there any further scientific evidence of that, or is that just his speculation?
It's a speculation, but it is something interesting because we did hear one report actually in my hometown in Pittsburgh at the University of Pittsburgh actually reported the same thing, that people have a lower viral load. And most of us think that this is a testing artifact, that we're testing people much quicker before the viral load has peaked, or people are getting infected with a lower inoculating dose because there's so much social distancing going on, and that the amount of virus you get infected with may have some influence. But this is something that we're trying to investigate right now. There is the virus, all viruses mutate. There's no evidence that this virus is mutated into anything more or less dangerous at this point. We're tracking that. But I think it's still the same virus. It's still just as deadly. It's just that we're getting better at diagnosing and treating it, I think is the most likely explanation.
So here's a question. I have never heard of this, so maybe you know what he's talking about. Any thoughts of memory T-cell studies from Germany and Sweden this week? Could immunity be more widespread than antibody tests suggest?
So antibodies are just one arm of the immune system. I think that lots of people put emphasis on it because it's easy to measure. But there is a whole other arm of your immune system called cell-mediated immunity, the T cells. Those are the same cells that HIV attacks. Those cells also are basically like they're kind of the conductors of the immune system. And you do get T cell immunity. And what we are finding is that people who recover from this have T cell immunity, which isn't something easy to measure. So even if you might not make an antibody response, you may have a T cell response, which probably will tell you that there likely is more population level immunity than just what the antibodies show. It's still a little bit early to be able to operationalize that, and we're nowhere near a herd immunity threshold, but T-cell immunity is going to be important as we figure out what exactly recovery means and how likely you are to be reinfected.
So what's the latest about treatments? Do we have improved treatments? Is the drug from Gilead, is it effective, and how effective is it?
So the drug from Gilead is called remdesivir, and it has an emergency use authorization from the FDA. It is not, Dr. Fauci called it not a knockout punch, and it isn't. It gets you out of the hospital a little bit quicker, which is important for hospital capacity, but it doesn't change mortality. They're trying to find a way to make it in an inhaled formulation to maybe give to outpatients, and if it kept people out of the hospital, that would be great. But we don't have any good data on that. We also have some good data on medium data, I would say, on a steroid. For people who get admitted to the hospital and need oxygen, that it decreases mortality. That's a big deal if it decreases mortality. We haven't seen all the details of the study, but it looks promising. And you want to make sure that you're giving steroids only to people who need it, though, because if you give steroids to someone who has mild illness, they actually get worse. Oh, wow. So you have to give it to people who actually need it. And I think we're going to work all of that out soon. So we do have that. There are monoclonal antibodies, which are antibodies that are derived, that are synthetically made, that people survive, they have antibodies, and now we've turned them into drugs. Those are in clinical trials now by both Regeneron and Eli Lilly. Those look really promising. And then there's convalescent plasma, which is also going on, taking the blood of survivors. So we have all of those tools. And I would say now, hydroxychloroquine has really, really dropped down out of favor. And now it's like a do not use. There's some trials we're still waiting for some trial data, but most people believe that that's going to go by the wayside.
So the big fans of hydroxychloroquine, who, all the experts in medicine who are fans of it, and I'm being cynical, but they claim that the problem with all the studies is it's always something, right? They didn't use zinc, or it's only good at the beginning. It's not good once the disease is fully manifest. It's good to, as a preventive. I guess Trump took it to help him prevent. Is there any evidence out there that any of this is true? Is it still something that people are looking at that we might see some positive test results from?
There are some studies that still haven't come back in, but every time they come in, it's always a negative result. I know there's one right now where they're giving it to healthcare workers as prophylaxis. I think that study we haven't seen the results from, but most of us don't expect to see anything good come from this except for side effects that occur. It's, the people that have been fans of hydroxychloroquine are not fans of the other drugs, which I think is strange. I mean, that they've kind of centered on hydroxychloroquine, but not talk about remdesivir, not talk about steroids, not talk about convalescent plasma. It's a very strange thing. And I wonder, if it was just because of that drug had a very loud spokesperson.
Yes, and it came out of the blogosphere, the right-wing blogosphere. It's kind of interesting. I mean, that's where Trump got it. He got it from some blog of some right-wing, kind of supportive of his. So vaccines, where are we? How promising is it? Is your sense, is the FDA doing everything it can to accelerate the approval of these?
Yeah, so I think this is probably the fastest we've ever went for a vaccine. We already have candidates in phase 3 clinical trials, and we didn't even know that this virus existed in December. Yep. So this is the fastest ever. The FDA, from my understanding, has removed every barrier. Now it's just a question of doing the studies to understand what the dosage is, how many doses you have to give, what the side effect profile is, what the benefit is. We know that it's generating antibodies, but we need to know how durable they are those antibodies effective? And the only way you're going to do that is through actual studies. So I think that we are going really quickly. People talk about having a vaccine by the end of the year. I think that's a little bit optimistic. We may have some batches at that point, but to be able to vaccinate the country or the world may take a period of 2 years. And we have to be prepared for some glitches that might occur when you're manufacturing at scale, because there's lots of things when making a small batch that don't apply when you're making a big batch. The government has made something called Operation Warp Speed, which means they're making the vaccine even before the trial data is ready, so that it's actually good to go, so that we don't have any delay, which is really, really unprecedented and a major financial risk for taxpayers, because some of those vaccines are going to fail. We know that they're going to fail. And at the same time, the Gates Foundation itself is putting together seven vaccine factories to be able to go manufacture right on the fly for different candidate vaccines. So we think this is really unprecedented. We've never seen anything like this before with the vaccine.
So is the government manufacturing in advance a variety of different vaccines? Because there are a number of them in clinical trials right now. Even
right, they picked 5. They picked the 5 most promising.
Okay.
Started manufacturing.
And then what happens to vaccines that are under development in Europe and in China?
So China actually already has one that they approved for use in the military. So Chinese military soldiers are being vaccinated right now with the vaccine. Some of the European vaccines, so the AstraZeneca Oxford vaccine, which is a British or a UK vaccine, that's part of our Operation Warp Speed as well. So we are incorporating the European vaccines into the US ones. The Chinese one's not, and it's not surprising the Chinese have the first vaccine candidate. They can move very quickly with anything they want to do.
Yes, and they can experiment on human beings in ways that I don't think we can. But and particularly their military, it's gonna be interesting what happens with that. So you expect sometime early next year, realistically?
Yeah, I think we'll start hearing stuff around fall, and then I think maybe early next year we'd start to have batches that are probably going to go to healthcare workers and high-risk individuals first, and then the general public. It'll be in tiers, and it's going to come out in tranches, and maybe more than one vaccine. We may have more than one that works, and you have to kind of have different guidance on which vaccine is best for which population group.
And what is the danger of, let's say, some people not getting vaccinated, that oppose to vaccines and not getting vaccinated? Is the danger just to them, right? I mean, if we vaccinate all the old people, do we care if everybody else gets vaccinated?
Probably it's not going to be, it probably won't be as dangerous if that's the case, because we know that what we're trying to do here is remove this as a threat to hospitals and to the vulnerable populations. And this virus has a very different impact on someone who's 20 versus someone who's 80. So if we could vaccinate our vulnerable population first, it may not necessarily be as important, but we do want to make sure that we can get those people vaccinated, because you don't want people to be chains of transmission. We know that this is very contagious. And if you're a 20-year-old and decide not to get vaccinated, but go and visit your grandparents or visit people that are vulnerable, you might be able to spread it. So I think that's going to be the issue. If you can vaccinate all the vulnerable population, yes, that's one thing, but can we vaccinate the entire vulnerable population? But I think that will probably be the first tier, as vulnerable population being vaccinated first.
You would think, you would think the public health officials would focus on that would be the entire focus in the first few months.
It should be.
Go to nursing homes and places like that and vaccinate everybody.
Yeah, I think that's likely what we'll see, is that the vulnerable populations and healthcare workers will be first, and then everybody else.
We keep thinking they'll do the right thing, and they keep disappointing us. So why assume anything at this point?
Right.
So this is a question you kind of answered before, but they might have come late, so I'll ask it again. Any evidence of a relationship between climate conditions and such as heat or humidity and the ease of spread of the virus?
So it's important to remember that when we talk about those climatic conditions, it has to do with surface transmission, which is a secondary mechanism of transmission. It's not, there's no time if I'm sitting next to you at a bar and I'm coughing and sneezing, there's no time for even if it's an outdoor bar, the sunlight to do anything. It's about surface transmission. And there's so many people susceptible that are out there doing things that we're not seeing this seasonal suppression that we see with other coronaviruses, because the virus can basically has an easy time finding people to infect, so it doesn't have to sit around on surfaces waiting. So that's what's happening. And we haven't, I think eventually this will end up having some seasonality, and we do definitely have to prepare for acceleration when we get to the fall, because there you're going to probably see much more, you may see much more pronounced seasonality. So we could see environmental transmission become much more important as people huddle together inside, as maybe schools are starting to open. We have to be prepared for that. But right now we're not seeing full suppression of seasonality, and it makes sense based on how many people are susceptible.
Yeah, I mean, I heard at some point that when it's in the air and it's humid, water molecules attach to the fat surrounding the virus, and it drops to the ground faster. And so it stays in the air less time when you're in a humid climate.
Yeah, there's lots of different studies, and even humidity affects the little hairs inside your nose and how well, the little microscopic hairs, and how well they can work. So they actually work better at higher humidity and worse in lower humidity. So there's a lot of different, it's hard to weigh exactly what happens with these viruses when the seasons change.
So last question, just about, because I'm always intrigued. I'm intrigued by how well Asia has dealt with this. And we're not just talking about the major places in Asia. I mean, we know how China deals with it. It can just shut down everything for a while and just take care of it. But even this market, they found a virus in this market in Beijing, and it seems like they were incredibly efficient at tracing people and shutting down the people who actually had the virus without shutting down all of Beijing. But if you look across Asia, from Vietnam to Thailand to, of course, Singapore, Hong Kong, and Taiwan and South Korea, they did a good job. It just seems like in that region, they have been unbelievably effective at controlling this.
I think it has to do with the fact that they prioritize the core functions of public health, because they're always worried about bird flu. They were all hit by SARS. They're worried about biological weapons. They're just really leaders, and they prioritize it at the highest levels of their government. And I think Taiwan is an example we always talk about. And they have a vice president that's an epidemiologist, a PhD in epidemiology. I mean, our vice president messed up an HIV outbreak in Indiana by not allowing people to do needle exchange. Look at Vice President Taiwan, Vice President of the United States, very, very different. And that pretty much explains the entire thing. But I think it is that they prioritize it. They know that this is a real risk, and they're just much, much better at doing it. I think that in the United States, you have this kind of failure of imagination. Could an infectious disease, a small little virus, disrupt the entire country? I don't think they think about that. I mean, even now, the new budget for the White House, the pandemic budget for the Department of Defense, they're actually defunding they're taking down the funding for pandemic funding again in the middle of a pandemic, and the quote was that we want to focus on super duper missiles, not on these non-kinetic threats like pandemics. So it's just a very, very strange failure, evasion at the highest level to realize that infectious diseases are going to be a threat, and they continue to want to fail. It's almost as if they're setting it up for it to happen again.
And they can be biological weapons. That is, the Department of Defense should be protecting us from biological weapons. Now, I mean, this is natural, but our future could entail a real. It's just bizarre. It really is.
So we were very good at pandemic preparedness for a period of time after the anthrax outbreak, when people were really working on trying to develop that during the Bush administration. And as anthrax was 2001, and now we're 19 years away, that's kind of faded from memory, and a lot of that funding has also faded from memory.
So one quick one, because I just read this. Should we be worried about the potential swine flu out of China?
Yeah, so this is something I don't think the general public needs to worry about right now, but it is a very interesting virus. Swine viruses, flu viruses can jump into humans, and this one, the G4 virus, has some characteristics that make it have the ability to likely be a pandemic pathogen at some point. It is preferentially binding to human receptors, We've seen antibody tests positive in some of the agricultural workers in China. So this is something that we have to keep on our radar from the preparedness standpoint. It's not, and with flu, the pandemic characterization is a little bit better because they already start making a vaccine for these pandemic strains, at least the beginning stages. So that will likely be prioritized and be kind of stored away in a freezer so we have it. But it is something to watch. And I still think that influenza is the biggest infectious disease threat we as humans face, because time and time again, it has caused pandemics. And even though this one is very, very bad, it is not 1918.
No, and as you've said, the strains and the variations of these things, it could be a lot deadlier than what we have right now. And if it's really scary, given how incompetent they've been, to imagine what would happen if we had a really, really deadly one. Or even one that just hit young people instead of old people. Just if you just flip that, the dynamic would be catastrophic.
Yes, it would be disastrous. They failed to even handle a pandemic with a mortality rate of maybe 0.5 or something like that. If you had a 30% mortality rate, it would be complete cataclysmic with this kind of incompetence.
All right. On that positive note, thank you, Amesh. Really appreciate it. Thanks for taking time. Good luck on your TV show later today, and we'll see you soon.
All right. Bye. Thanks.
Thanks, Amesh. All right, guys. Hopefully you got a lot out of that. I certainly enjoy having Amesh on the show because you get the science, you get it objectively, you get it free of all the kind of nonsense that is out there. And what is truly just stunningly shocking is the incompetence. Just the incompetence, starting with the federal government, starting with the Trump administration. And I know you all think I have Trump, I'm biased against Trump, and I have this anti-concept called Trump derangement syndrome. But if you can't see that the Trump administration, starting in January, has basically failed on a scale that we rarely see in history, if nothing else, this is a reason why he should not be president for one extra day. I don't believe that even some of your worst candidates for president would have failed this badly in this case. Trump has showed zero leadership. He has time and time again minimized this issue, time and time again pretended that it doesn't even exist. We should have never had lockdowns. We don't need lockdowns. We should have never been the only country in the world that is seeing a nonstop increase in cases, moving from region to region, hospital, area hospitals to area hospitals. It's insane. Now, it's true, mortality here is low. I mean, to Amesh's credit, from the beginning, again, from about late February, I had him on the show, I think, in February for the first time. He was saying the mortality rate is probably 0.6. Not the end of the world, far from the end of the world. Much more something manageable, particularly given that mortality is completely concentrated in one population: older adults. And why couldn't you just control for them? And they didn't. Because from the get-go, Trump spent the whole month of February denying there was a problem and telling us nothing was going on and there was nothing to worry about and the virus would disappear and everything was under control and there was no issue at all. Don't worry. Be happy. And then they squandered the opportunity to test by relying on the government bureaucrats to do all the testing and all the development instead of using the resources of the United States free market system, whatever's left of it anyway. And then open, don't open, close, don't close, no consistent message, belittling of the CDC, belittling of his scientific advisors, and therefore relying completely on state governors to control, and state governors did their thing. And for the most part, they screwed up, partially because it was already late. And now you're seeing how even with plenty of time, they've screwed up. And from the beginning, it was clear what you have to do. I mean, basically 4 things: test, We're still not testing enough. We got it up to 500,000, maybe 600,000 a day. We should be at 2 million. Trace, we're not tracing almost at all. Isolate. We isolate those we test, but we should be isolating. We should be testing more, and we should be testing those we trace. If we don't trace, you can't find pockets of it. You can't find the people who are infecting others, and it just continues to spread. So test, trace, isolate, and then fourth, cocoon the vulnerable. Isolate the vulnerable. And that, again, we fail dramatically, and nobody talks about it. Nobody at the federal level, nobody at the state level talks about the fact that there's certain people, and I've said this for 3 months now, it drives me nuts. Don't treat everybody the same. Isolate old people. Lock down old people. Lock down the nursing homes. They can't even do that. I mean, 45% of all the deaths have occurred in nursing homes because they didn't do it. And they were sending people literally from the hospital to the nursing homes. And they did this all across the country. It's just insanity. And there's, we're talking about a federal government that spends trillions of dollars. We're talking about state governments that spend billions of dollars. They don't have the money to hire more tracers. They can't cut other stuff in order to do this. Now, it would be one thing if everybody was said, you know what? Whoever dies, dies. We don't care. We're not. But they're shutting down the economy instead. They're destroying small businesses instead. And they're destroying the future of this economy instead by printing money and by doing stimulus packages because they have to, because they shut down the economy in step one. They have to do something in step two, which is destroying the economy long term. I have never in my life seen such a level of incompetence, stupidity, that is costing tens of thousands of people their lives and is going to cost all of us economically for at least a decade. And nobody cares. Nobody cares because everybody is either left or right. So the right will do anything they can to protect the president and to claim that this is nothing. And some of you probably believe this is a hoax. And that's probably why there's not a lot of people watching live, as many as people watching live when I would talk about BLM or something, because, many of you just think it's irrelevant, but it's not. And partially it's not irrelevant because the people in power are not taking it as irrelevant. So it matters one way or the other. But it matters to people's health, particularly older people. And then the people on the left, man, they're locking themselves at home and they're going after anybody who doesn't wear a mask, and they're panicked like there's no tomorrow because there's no leadership, not on the right and not on the left. There's just no leadership anywhere in this country. And again, Trump's behavior throughout this crisis, that should be enough to justify kicking him out of office. Now, ideally, we would have had a Republican primary and somebody would have beaten him in the primary and been a Republican candidate that maybe you could vote for. But the Republican Party couldn't have a primary. And the Republican people in the Republican Party didn't want a primary because they are so enamored, so fixated on Donald Trump. So this is who we got. What we've seen, again, over the last 6 months now, since January 1, certainly since January 31st, is the worst case of incompetence, the poorest, weakest case of leadership I can recall from the history of this country. Not that this is the most devastating one, although tens of thousands of people have died for no good reason other than our politicians blew it. And that's why people die. Brandon asks, but what can we do besides just try and be careful if we don't lock down? we will have to simply learn to live with COVID until vaccine emerges. Yes. But what you need to do is be careful. And be careful means wearing a mask, maybe wearing a face shield, maybe, and primarily just socially distancing, just staying away from people, keeping enough distance, particularly indoors. Outdoors, I think I wanted to ask Amesh about the protest, but outdoors is a lot easier. There's a lot more ventilation. There's a lot more movement of air. You're less susceptible outdoors to get a significant load. Most of the outbreaks I've read about were things like birthday parties indoors, where it's indoor, where there's a lot of people, where they're not wearing masks, or they're wearing sloppy masks, and the virus is just all over the place. But it is about being careful. And nobody is being careful right now. And what could politicians do? They could talk about it. They could explain it. They could encourage us to be careful. Instead of, the virus is just going to disappear by itself, as Trump said. And what politicians can do, and what Amesh again has been saying since February or January, is we can test and isolate. Test, trace, and isolate. Test, trace, and isolate. What you do when you do that is you take all the people who are going to infect others out of circulation. You isolate them. And by isolating them, you kill the virus. I mean, the fact is that Asia had the virus earlier than us, so South Korea had it about the same time of us. And while it gets little ramps up, little spikes, they quash them, and on life goes. And Taiwan, same thing, Hong Kong, Singapore, all these places, people are living their lives in normal ways. They're not worried about it because they've squashed, destroyed the virus. It's not a threat anymore. Why? Because they tested, traced, and isolated until they got to close to zero. And then they went on. I mean, the fact is that right now, the United States is the laughing stock of the world. The mightiest economy, the mightiest military in the world. And Amesh says, what's even worse than this, what Amesh says is, we wrote the textbooks on how to deal with viruses. We wrote the textbooks on how to properly do testing, tracking, and isolating. And we failed at it. The rest of the world, pretty much everywhere in the world, Europe, that we all love to make fun of, socialist Europe, statist Europe, Asia, almost every single country in Asia, they've all done better than we have. All of them. And the only reason is that our politicians screwed it up in ways that theirs didn't. I mean, the only other country that might be similar to us is Brazil. And yet, nobody cares. I don't know any Trump supporter who stopped being a Trump supporter because of coronavirus. And I don't know any lefty who stopped being a lefty because of how badly governors have dealt with this. Sweden has done better than the United States, much better than the United States. It hasn't done great. But it's doing better than the US. And the reason it didn't do great is because it didn't do enough testing, tracing, and isolating. And what they didn't do really, again, like the United States, what they didn't do is they didn't isolate the vulnerable population. They didn't put enough resources into protecting old people. So they got large numbers of deaths in nursing homes. And that really, really hurt them. But I think they're still better off than we are, particularly given the spike now. And we'll see what kind of consequences that has to death rates. Mortality rates will come down because most of the people getting infected right now are young. But they're not going to go to zero. There's still a heavy overload on hospitals in places like Houston and some places in Arizona. So it's so disappointing. It's so disappointing. And it's not that I'm disappointed in our politicians, because I've learned not to expect much from them. What disappoints me is the American people. We don't seem to care. We're not willing to hold our politicians accountable. We're not willing to challenge them. We're not willing to say, we're not willing to blame them. We're not willing to blame them. Democrats blame Republicans. Republicans blame Democrats. But we, as the American people, the land of individualism, the land of liberty, the land of freedom, the richest, strongest, most prosperous country in human history, doesn't seem to care. Doesn't seem to care. Yeah, we get what we deserve, Matt says, and absolutely right. All right, if you have Super Chat questions on any topic, I'm happy to take them. Otherwise, we might call this a short show, 50 minutes, and call it a day. So I'm actually at up to you. Let me just tell you about what we've got coming up. I'll do a show tomorrow. Not sure exactly what time. We'll do a show tomorrow. Maybe also in the middle of the day. We'll see. And I'll do it. Tomorrow's show will be on the 4th of July. So it'll be a sad show. It's going to be a little bit of a sad show. Hopefully inspiring show, but it will be a little bit sad. On Saturday, I've got Brad Thompson in. We're going to talk about the nuttiness of the fringe right, the new fringe right. He's got a term for it, but I can't remember what it is. And Brad's essay, I'll link to Brad's essay when I start advertising the show. That'll be at Saturday at 2 p.m. Eastern time. And then on Sunday, I've got Andy Bernstein, also I think at 2 p.m. East Coast time. And we're going to talk about a bunch of contentious issues. We'll start with racism. We'll talk about monuments. Maybe we disagree. I don't know that we do. We'll find out. We'll find out if we disagree. But the idea is to bring out some disagreement and see what happens. We'll talk about who's a bigger threat, left or right. I think we'll disagree there maybe. And we'll talk a little bit about Donald Trump, and we'll probably disagree there. No, again, not on the substance, more on the relative danger. I don't think Andy's a fan of Donald Trump. And yeah, maybe we'll talk a little bit about 4th of July. I mean, Andy can get pretty colorful about his love of America. So we'll talk about that. So we got C. Bradley Thompson on Saturday, Andy Bernstein on Sunday, and 4th of July show tomorrow. Andrew asks, venting here, but it's just a mask. It's just a face guard. What's next? A spacesuit? When can we move on with our lives in spite of mild virus? But it's not a mild virus for people who are old. So you might say, I don't care who I infect. I don't care if I infect my grandfather and he dies from it. I don't care if I infect my neighbor's grandfather because I infect my neighbor and my neighbor infects his grandparents. What's the big deal about wearing a mask or a face mask for that matter if it saves some lives? It saves the lives of older people. This is not a mild virus for them. It's a mild virus generally for people under 50, so maybe under 60. But if you're over 60, certainly if you're over 65, this is not a mild virus. A significant percentage of those over 65 who get this virus land up in hospital, and a significant percentage of those who land up in hospital land up dying. Now, I don't know how you think about that as being a mild virus. It's not. It's 5 times more deadly than the flu, but that is 5 to 6 times more deadly than the flu. But that is deceiving because it's not deadly at all for the most part, in rare cases for young people, but it's like, 10 times deadlier or more than 10 times, 20 times deadlier if you're old. So I don't know about you, but I care about older people. And I don't want to be responsible for them dying. And if I have to wear a face mask so that older people don't die, then really, you're going to make a big deal out of that? You're going to get all upset because you have to wear a face mask so some people don't. I don't understand the attitude. I really don't. And I don't understand the fiction, the BS, that this virus doesn't matter. It does. People die. Lives matter. And it's, even by Amesh's estimates, 5 times or 4 times or 6 times more deadly than the flu. And you can do something about that. And if you can, by changing your behavior just a little bit, prevent people from dying, why wouldn't you want to do that? Do you think that's egoism, not to care about other people? Not to care about whether they live or die? Is that what egoism means to you? It doesn't to me. for one, I know people that age who I care about. Whether it's my parents, whether it's Leonard Peikoff, who's well into his 80s. And if he got the COVID, his chances of survival are very, very, very small. So I don't understand this not caring. Now, I don't care if I get it that much, but if I got it, I would stay home. I would self-isolate. I wouldn't go out. And because there's a chance I have it and I don't know I have it yet, what's the big deal about wearing a mask when you're indoors in a public space where there are other people around you? I don't understand that. I don't wear a mask outdoors because I think its value outdoors is basically zero. But indoors, what's the harm? And I can imagine a virus wearing a spacesuit might be necessary to save your lives, to save other people's lives. So you wear a spacesuit. Now, a spacesuit is a lot more difficult than just wearing a stupid little mask. I don't get this. I really don't. I get that you don't think it's a big deal because you probably won't die of it. But is your moral framework, is your view of what egoism means just to care about you and not to care about people around you, including people you might have a relationship with or you might even love? That's weird. That's not egoism. So come on, guys. Just think. Stop. Put aside the politics. Look at the data. The data is clear. For some people, this is deadly. By wearing a mask, you can prevent them from getting the virus and therefore dying. Are you willing to wear a mask or not? I mean, the answer should be very simple. And if you don't think people are dying from this, then you're brainwashed into an unscientific state of mind, which is horrific. All right, now a completely different topic. Stephanie Kelton is on Biden's economic advisory team. She is the main advocate of MMT. I know Stephanie Kelton. I've met her. And she's generally in Biden's economic advisory team, but that's only because he's trying to appease the radical left, because she's originally on, she was chief economic advisor to Bernie Sanders, and was both campaigns, both in 2016 and this time around. How dangerous could this get? So let's think about that. MMT is this theory that you can just print money. That as long as the economy is supposedly not at what's called full capacity, you can print money and distribute it. And if you do it smartly, whatever the hell that means, right? The central planners know what that means. They're good at it. The claim is. Then it only does good. It doesn't do any economic harm. And it can really boost the economy, and you can get great stuff done, and you can build Green New Deal or whatever. And the idea is, the danger is that with Stephanie Kelton on Biden's economic team, that when Biden becomes president, if Biden becomes president, they will implement MMT. Well, this is the question I have for you. How far are we from MMT right now? I mean, under a Republican president, a Republican Senate, we have basically just created almost $3 trillion out of thin air. That's on top of running a deficit of $1 trillion. So basically $4 trillion deficit. Above and beyond that, we have a Federal Reserve supported by a Republican president printing another bunch of $1 trillion, up to $6 trillion. Now, it's not additive because some of it overlaps, but net, we're adding $6 trillion. So MMT would do an extra 1 or 2. I mean, really, what is the big difference? Is there a non-MMT candidate on the ballot this year? My guess is that in the next few weeks, Donald Trump will unveil, or the Republican senators will unveil, a massive additional stimulus plan probably including infrastructure, but maybe checks to every American again, maybe some more help to, although small businesses haven't availed themselves of all the help that was given before. But you're going to see a massive new stimulus bill, maybe another $1 trillion, maybe more, maybe $1.5 trillion or $2 trillion. There was no anti-MMT candidate on the ballot. If you think Biden's going to be worse than Bush, worse than Trump, I don't think so. Because this is the thing about Republicans. They're a decent, I won't say good because I don't think they're really good at anything, but they're a decent opposition party. So they're pretty good at stopping the crazy ideas of the Democrats if they have enough power to do so. But when they have control, they cave to the Democrats completely. So right now, we're seeing from all forms of government, we're seeing from our government today, a complete, the Trump administration is completely capitulated to the Democrats' agenda. We have massive government spending on a scale that could only have been imagined. I mean, Obama could only imagine the scale of spending we have today. When he did a $900 billion stimulus package in 2009, Republicans went apoplectic. They went nuts. They went crazy. Now, $900 billion sounds unbelievably sane. It sounds normal. It sounds completely acceptable. Trump administration does $3 trillion, which is 3 times more than what Obama's stimulus was. So don't tell me, Icepick agrees with me. Don't tell me Biden is a particular threat when it comes to government spending. That's the one area Biden is not a threat. My guess is that if Republicans can hold the Senate, and it's a big if, my guess is government spending will go down under a Biden presidency, just like it went down in the last 6 years of Obama administration. If you look at GDP, at spending as a percent of GDP, in the last 6 years of the Obama administration, it went down every year. And then with Trump, it's gone up every year. So from a government spending perspective, which is the size of government, the level of government intervention in the economy perspective, the best combination historically has always been a Democratic president and a Republican House and Senate. Always. So I've said that my wish, not that anybody cares about my wish, not that I have any influence on the vote, not that I can dictate who's going to be president, but if I had my wish, then we would have Biden as president and a Republican House and Senate. And if I were voting, which I can't because I'm in Puerto Rico, I would vote for Biden and for Republicans across the board, whether I like them or not, just so there'd be a Republican chance of a Republican majority in the House and Senate. That's what I would do. Unfortunately, I think what's going to happen is that if Biden wins, Democrats will capture the Senate and the House. They might even have an historic gains in the Senate and the House. Trump will have basically devastated the Republican Party, and as a consequence, devastated this country by handing over governance of this country to the Democratic Party across the board, from the House, the Senate, to the presidency. And that will be his legacy. Not what he did during 4 years, which is mostly horrific, but some good things. That won't survive. What will survive is the fact that he brought to power Democrats across the board who will really destroy this country. But you can't escape that. You know, as soon as you elected Donald Trump, as soon as you guys voted for Donald Trump, this was what was going to happen. Now, I guess there is an alternative where Trump actually wins, and it's possible because the left is so crazy. The left is so nutty that if they continue to try to burn down this country, if they continue to topple monuments, if they continue to be out in the streets and riot, if they continue to ignore the rule of law, then there is a real possibility Trump will win again. Even if Trump wins, I doubt Republicans will hold the Senate or the House. So we will see. I do find it interesting that a lot of that stuff is moderated a little bit. You've even seen, I guess, Seattle take back Chaz, right? I actually like the chief of police in Seattle. She seemed pretty tough and committed. It was the mayor who was complete wimp over there. But it seems like they've taken it back. World did not end because we had Chaz. A couple of people lost their lives because we had Chaz, but the world did not end, and the world would not end. I mean, I think if Democrats are smart, then they will really tone down the demonstrations. They'll tone down the riots. They'll tone down the violence the closer we get to the election. Because the only chance I think Trump has is for the Democrats to get completely nuts, so wacky that independents say, whoa, we can't have those people in power. And they'll vote for Trump in spite of his abysmal record. But yes, somebody says Trump is a leftist. He's absolutely a leftist. When it comes to economic policy, he's absolutely a leftist. And that was my whole point about MMT. There's no big difference, right? There's no change. MMT, we already have MMT. Just not as scientifically distributed as Stephanie Kelton would like. Right? There's a great review. I posted on Facebook a really good review of Stephanie Kelton's book by one of my favorite economists, the grumpy economist, John Cochran from the Hoover Institute, formerly from Chicago. And grumpyeconomist.com. You can find him, and he writes some really good stuff. All right, good. I think we'll call this a day. We're an hour and 10 minutes, one of the shorter shows, but that's good given that I've been doing 2 hours or longer shows. Tomorrow we're going to do a 4th of July, so prepare questions. I'll try to make it motivating, not too depressing. Also, I want to say this. A couple of shows ago, I did a show on civilization crumbling, and I tried to inspire you to do more about it. Try to inspire young people to form a movement to change the world. To change the world. And those of you who are inspired, those of you who'd like to do something, what we're going to do is we're going to do a Zoom call, a private Zoom call, with all the people who actually want to do something, who have ideas, who want to get involved, who want to take action. We're going to organize a Zoom call. If you want to participate in that Zoom call, email me, yaron@yaronbrookshow.com. Put as the subject line Zoom, right? Put as the subject line Zoom if you want to participate, if you want, and this is primarily for young people, but you don't have to be a young person, but I want you to be serious about taking action, doing something, and I want you to come with ideas. Don't come expecting me to give you ideas, because as I said on the show, I don't have any. It's your future. You got to come with ideas, and you're going to have to organize them. I will support you. I will provide the intellectual firepower. I will get other people involved to help you. You guys need to do the work, though. So if you want to do that, then let's get this movement going. Somebody says here, establishment objectivists on notice there's no moral flourishing under fascism. Yeah, I know. I'm trying to prevent fascism here, or socialism. They're both the same. And we got fascism on one side, socialism on the other. And you're not going to get out of this fascism problem through elections. And I agree with Jay completely about Hong Kong. Hong Kong, what happened in Hong Kong over the last few days is one of the great, I mean, it's already probably the number one tragedy. Whoops, we lost connection. You guys getting video? I know why. Facebook seems to have lost video, but all right, looks like, all right, video's back. You have got, so what happened in Hong Kong is already the biggest tragedy of the 21st century. Hong Kong, one of the greatest places on earth in human history, is basically dead. Basically dead. The Chinese just killed it. The Americans stood by and watched. Did you hear Trump recently say anything about Hong Kong this past few days ago? Anything? I mean, the Senate passed some sanctions on Hong Kong, which Trump signed a couple of weeks ago, but any moral statement, any bully pulpit, any moral courage, any moral support for the people of Hong Kong who are now under the boots of fascist China? Nah, nothing. Silence from the White House. Silence from Europe. Have we offered all citizens of China of Hong Kong citizenship in the United States? If they want to escape that place, they can come and create Hong Kong here in the US. I mean, I wish I had more power here in Hong Kong, because that's what I would do. I would invite everybody in Hong Kong to come to Puerto Rico and help me establish the Hong Kong of the Caribbean here in San Juan, Puerto Rico. What happened in Hong Kong is that the Chinese government has implemented a security law that applies to Hong Kong that basically makes any criticism of the Chinese government illegal. It basically applies Chinese law to Hong Kong, and it basically kills free speech in Hong Kong. And they can take any action, any words you say as a threat to the security of China, and they can come and arrest you and take you into China. And I've been to Hong Kong, so Matt says, and I've introduced Hong Kong freedom fighters to Ayn Rand. Many of them have read Ayn Rand. Many of them support Ayn Rand. Many of them came to my talks. I have no idea what watching PTLD Andy keeps it real. I don't know what that is. I don't know what that means, Jay. Sorry. Yeah, I don't know. It's hard. It's hard for me. I know a lot of people in Hong Kong. I've visited Hong Kong often. I've got friends in Hong Kong, and it's just sad. It's just unbelievably sad. And again, just like Corona, just like a lot of other things, the government of the United States has said nothing. Nothing. And you think Donald Trump is tough on China. You think Donald Trump is tough on China. It's kind of funny. Kind of funny. All right. Important John says, UK has said Hong Kong citizens will be offered a route out of the former UK colony. About 350,000 UK passport holders, 2.6 million other eligible will be able to come to UK for 5 years. That's great. I hope they give 2.6 million. They should immediately issue them passports so that they are immediately dual citizens. So if they fear that they are going to be arrested by the Chinese authority, they can immediately get on a plane and go to the UK. I would, my wish would be that it wouldn't be just those 3 million people, but this would be expanded to the entire population of Hong Kong, which is 7 million people. I can't think of a better infusion. People always complain, oh, immigrants come and they vote left. Well, bring in immigrants from Hong Kong. They know what freedom is about. They've been more free than we have. They've been more free than we have. Maybe if they come to India, they'll bring the freedom with them. So why don't we invite all 7 million of Hong Kong, all that talent, all that human capital? Let's bring it all. Bring it all to the United States or to the UK. We'd be better off. They'd be better off. The world would be better off. And we deny China their talent. How about that? Oh, Andy, I don't know how to pronounce his surname. Nago, the Portland guy who was attacked by, has been covering Antifa in Portland and has been attacked by Portland. What's going on in Portland is truly horrific. I mean, the police have basically locked themselves in the precincts and letting the Antifa type idiots just, evil bastards more than idiots, just take over the streets. They attack police precincts, and the police do nothing. It really, Portland is, I've got a friend in Portland who's actually seriously considering moving to Austin, Texas, because Portland is just nuts. Portland is completely nuts. And the only people who ever stand up to Antifa in Portland are the white supremacists. And they usually have a fight every weekend in the center of Portland. It's just become disgusting where Portland has become this hub of white supremacists on the one hand and Antifa on the other hand, going at each other, and the police doing nothing, just staying back, having no power, doing absolutely nothing. Yeah, I mean, what's going on in Portland is horrific, but the assumption that the solution for that is, and I'm not saying you're assuming that, but the assumption that the solution for that is Donald Trump is bizarre, because Donald Trump only makes all of that much, much worse. And the right only makes that much, much worse. Yeah, I mean, Portland it looks like the worst city in the country. Seattle is a close second, but just Portlandia. If you ever watched the show Portlandia about the leftist in Portland, it gives you a little flavor of the wimpiness of the people there. And I mean, Portland used to be a beautiful, beautiful city. It rains too much, but other than that, it's one of the most beautiful cities in the United States. And it's being destroyed. It's being destroyed. Yep. All right. Thanks, everybody. Thanks for joining me this afternoon. Have a great 4th of July weekend. I hope there are fireworks in your city. I hope we can celebrate what this country means. I don't know that there are that many people to celebrate with anymore. We'll talk about that tomorrow. But at least those of us who know what this country is about, those of us who appreciate what this country stands for, let's celebrate the 4th of July. I wish you all a great 4th of July weekend, and sanity and peace for all of you. Keep thinking. Bye, everybody. Talk to you soon.